my name's Rob and I'm from Active Health Clinic, and in this video I'd like to explain a tool that we use here at the clinic called Neurodynamics. So Neurodynamics refers to this idea that our nerves in our body need to actually move when our body moves. So when our arms and legs and our trunk move, the nerves move along their pathway. So this concept is really important to understand, because when nerves get a little bit stuck, and they do, that can actually cause referred pain. So people with maybe a sticky nerve in their neck can feel shoulder, elbow or wrist pain, sometimes called carpal tunnel or tennis elbow. Now, it's not always the case, but it's certainly not something that we should not overlook. Now, with this, the tool that we often use is called flossing, so nerve flossing. The idea here is that nerves really enjoy movement. In fact, it nourishes them. So whenever we move our bodies, that actually feeds our nerves fresh nutrients through more blood supply, more oxygen supply, and it actually flushes out metabolic waste and also inflammation. So what we can actually do here is move in such a way that drags the nerve up and down its neural pathway from one end to the other. So let's just say if we're dealing with the nerves in the arm, we would actually tug at the nerve from the hand end and then from the neck end and vice versa, and just go through that sort of fashion. So what this will achieve is a couple of things. So as I said previously, it provides the nerves with fresh nourishment and gets rid of any sort of inflammation or metabolic byproducts, but it also sharpens up our brain's representation of our arm. And often with pain, especially persistent pain, our brain and nervous system can become what we call smudged, or just less accurate, and that's often when persistent pain persists. So by adopting this practice, we can actually undo that and make the brain a lot more sharper and clearer and more accurate about pain. Now, I'm not going to show any demonstration of neurodynamics in this video, because I just don't really have the space for it and I need a partner to do that with. But if you'd like to see a demonstration of this, come into the clinic and speak to your exercise physiologist about this. And there are actually a couple more videos on our Active Health Wellness Tribe on Facebook. So join that and check those videos out.